and then I'm going to hand over to Julian to kick us away.
Thanks very much, Karen, and welcome everyone. Thanks for your interest in our work in Hartlepool. I'm Julian Penton. I work for the Hartlepower Community Trust. We support and champion Hartlepool's voluntary and community sector. And I'm joined by my two colleagues on the Young Person Social Prescribing project, who I'll let them introduce themselves.
Hi there, my name's Sarah McClusky. I work for Hartlepool Borough Council Youth Service as the Youth Work Lead, and I line manage both social prescribe and link workers, which includes Amelia. So I'll hand over to Amelia to explain more about her role.
Hello, I'm Amelia Turner, Young Person Social Prescriber. I'm employed by the PFC Trust and then managed by the Council's Youth Service. So I work with young people aged 11 to 18 and then up to 25 if they've got a lifelong learning difficulty. So I work one-to-one with them to begin with, build a positive relationship, find out the hobbies and interests, and then introduce them into positive groups and activities in the community.
Thanks, Amelia, Sarah. So Amelia has just given a really good thumbnail of what this project is all about, which I'll elaborate and give some background on before handing back over to Sarah and Amelia to fill in any gaps, which I will inevitably leave. We are at the end of a 2-year pilot process of testing out young person social prescribing in Hartlepool. The project is just over 2 years old in terms of delivering the activities that Amelia referred to young people in Hartlepool. And we had something like a 6-month development phase to reach this point. We have a really collaborative governance model involving partners from the NHS who fund Amelia's post, from the local authority who've provided all the professional management of the service, and from several voluntary and community sector organisations who've contributed to the management and oversight of the work. So we call this a hybrid governance model that builds on partners' commitment to achieving certain shared agreed outcomes. In this case, working alongside young people whose lives are not working in a way that they would like, often parents are struggling with, and other professionals as well. Funding comes from the Additional Roles and Responsibilities Fund. I know I've not got that quite right, the R's Fund. And also Amelia's colleague, Mel, is funded by the National Lottery. And this is how our hybrid system works, in that Amelia is not employed by the local authority, yet she's managed by them, because there is this commitment to quality, and the local authority we judged was the best place to be able to manage a project of this sort. Amelia has said we work with young people 11 to 18 or up to 25 if they have a lifelong learning disability. The ethos of the project is very much based on youth work principles. So it is a completely personalised service in which the link worker connects with a young person who will have been referred in either by themselves, their families, or numerous other agencies, which I'll return to. And the young person leads what is going to work for them in terms of turning their lives around in whatever ways are possible. So the first most important step is therefore to build rapport with the young person, to make a trusted connection, because until that has been made, there is very little chance of any kind of positive outcomes. We deliberately use the social prescribing model, which is well known to NHS colleagues and is a really healthy innovation within the health service, recognising the relevance of community-based and neighbourhood-based resources for people to access, given that, I don't know, 50% plus GP consultations going back a year or two were psychosocial, emotional, financial issues and not at all medical issues. So we've deliberately borrowed that model. The big difference with adult social prescribing is this crucial building of rapport with the young person, building of a relationship through which, through the young person's preferences and some understanding of them as an individual, the intervention is then shaped around that particular individual's needs and interests. So it's completely personalised. No two interventions are the same. It is also completely non-medicalised either. Although a lot of young people are seen who would qualify for experiencing, I would say, low to medium level mental health issues, we never go anywhere near, we're not qualified to, but we don't think it's helpful to go anywhere near to any kind of diagnosis or thinking about pathologies. It's the young person who is centre stage and they guide what work is to be done. So that is the ethos, and should anyone have any questions about that, and Amelia may well want to fill in a little on what I've talked about, that is the ethos. Over the 2 years, we've had something like, Amelia and Sarah will know the exact numbers, it's around 150 referrals. So a great many young people have been seen. We really have got a good feel of how this model works now. And some, not all, but some of the lives of those young people have been transformed as a result of their connection with Amelia and her colleague Mel and the work that they've been able to do with them. So we know that we're onto something with this model. In terms of referrers, Hartlepool is a very small town and everyone kind of knows everyone else. But one of the things that the youth service brought was the respectability and the trust of multiple other agencies. We have a very high quality youth service in Hartlepool and they have an extremely good reputation. So there was no barriers to developing links with potential referrers. Let me go through the list of the kinds of people that have referred into the project. So a lot of social workers refer in, the early help team, for example. CAMS are referring in, NHS adult social prescribers, the local carers project, parents, schools, the youth service itself, which does many other different areas of work. They come across young people who ask in some cases and are recommended to engage with a linked worker. School nurses, school attendance officers, nurse practitioners and GPs, the Youth Justice Service, and other therapeutic services. The range of challenges that the young people who are referred in are wide. And one observation about the kinds of young people who have been referred in is the increasing severity of some of the issues that they're facing: school refusal, self-harm. If there was to be some kind of sort of unifying theme, and I'll look very closely at Sarah and Amelia's reaction to this, it's very low confidence, often social isolation, not having the confidence or the skills to be able to connect with the wider world, to form positive relationships with other young people, with adults. And the goal of the project is obviously to build young people's confidence by connecting them with various community resources and activities where they can start to grow and learn how to succeed in life more effectively by learning those essential social skills, by overcoming their social anxieties, by dealing with the issues that have brought them into the project. Quite a few young people come from troubled homes where parental support is not what would ideally be provided. And that is one of the issues that I'll return to finish off with some of the challenges of the project. Let's have a look at some of the other issues that have come up. Yeah, some neighbourhood-based problems, the effect of localised criminality and very challenging sort of neighbourhood environments, and childhood trauma also figures. So you can immediately see that the project shades into mental health related support, and that is one of the learning points of this, of where support to a young person in a project that is designed to connect them into neighbourhood resources becomes more of a longer term, highly supportive intervention. Now, we don't have an answer to that. Longer term, we would like to work more closely with the likes of CAMS and see how we can become better integrated to help manage the huge demands that have arisen for children's mental health support post-pandemic. The project has been, evaluated by Exeter University. They were incredibly impressed with the degree to which the project has become embedded within the Hartlepool wider system, and that list of referrers that I gave is indicative of how many other agencies have picked up on what is on offer here, and are referring into the project. That, of course, brings its own issues because we're only talking about 1.5 workers. So it's been a juggling act managing the waiting list, because we obviously want to respond to people as soon as we possibly can once a referral has been made. But there have been times when there has been a several weeks wait before first contact could be made. So we're succeeding in offering something that people want, but it brings its own challenges. And it's also challenging with a pilot project finding ongoing funding. And we're really hoping that the primary care networks, who only find out what their funding allocation is very late in the day, we're very much hoping they can continue to fund the project, but it's up in the air. Right, let me ask Sarah or Amelia if there's anything they'd like to add or sort of build on from that summary of where we're at. You're muted, Sarah.
I think I'd like to say how lucky we are to live in Hartlepool, to live in a town like Hartlepool that does offer so much. We've got a very active youth service and a very active voluntary and community sector as well. So young people have an awful lot of choice in terms of what their interests and hobbies might be. And I didn't know, Julian, if you wanted to talk about the community work that also underpins our work as well. So where there is gaps in provision, we also have that capacity to be able to deal with that too.
Okay, yes, I'll briefly mention that. Thank you, Sarah. That's a really good point. An opportunity came up to fund a couple of days a week for someone to support the development of new work where Amelia was meeting young people who were saying, I'd really like to do X or Y, but that wasn't on offer in Hartlepool. So to give one example, there were several young people who were showing an interest in anime art. This is this Japanese cartooning, animation work. So with this other staff member who is based in the team in which I work, she went out and worked with Geek Retreat, which is a franchised sort of gaming company who have a very popular base in Hartlepool. She worked with them to develop a special needs offer. And that has now become a permanent feature of the offer of Geek Retreat. So for Tuesday nights, it's quiet night. It started off as SEN night, special educational needs night. And as the young people have come, parents are bringing their children from as far away as Darlington to access this service because there's nothing like it regionally that we know of. And it's a huge success, and the company have now actually completely embraced it and are looking to fund it independently. So that's an example of how, where a need has been identified for an activity not present, we've been able to actually work something up that then meets that need. Thanks for that reminder, Sarah. Back to you.
I think another thing as well, because when we linked in with Exeter University, and they were also looking at the other social prescribing projects as well. Something about our project is that we don't time limit young people, so we don't have a set amount of sessions for them to maybe decide what group they want. It's kind of unlimited, so we go at their pace, and when they're ready to take the next step to go to a group, we go off of them. So there's not like a time limit of working with them, which I think works well.
And that sort of follows from both the youth work model and the personalised care model, because everyone's different. And if it takes 6 sessions before a young person even feels comfortable enough to leave the home or to leave the safe space where they first met Amelia, then that's what it takes. But we're not going to limit, as Amelia says, the numbers of sessions around such a consideration, because it's a complete serving of the young person. I can see that we've used 20 of our 30 minutes. So I'm hoping that there might be 1 or 2 questions. I don't know if you want to link, Karen.
Yeah, brilliant. Thank you so much to Julian and Sarah and Amelia. Your technology held out, Julian. That's brilliant. So in the last few minutes, I'd like to open up to the floor and say, anybody got any questions, any comments? I think we've got one here. Please tell me if I pronounce your name wrong. Is it Mahfood?
Yes, no, you got it absolutely spot on. Thank you. Excellent work, and it's lovely to hear about the activity that's happening in Hartlepool. I know we have some buckets of social prescriber in Cumbria, and specifically in Maryport. What's the difference of what they do to what you do? I just get referrals from them, and I'm not sure what type of work do they do in Maryport and other part of Cumbria. Thank you.
I'd say I think a lot of it is to do with the hours as well, because with the activities, it could be like an art group that's on 6 till 8, or it could be a gaming group that's on till 7 till 10, and we've not got like hours that are 9 till 5. So whatever group that young people choose, we do go along and we actually introduce them to it. So we'll go along for the first few sessions with them until they feel comfortable, so we can address any issues that they've got, or if they want to know who they want to speak to, if they've got an issue, when we're not there, we'd be able to make them links so they feel comfortable enough to go on their own. For some young people, the families don't have cars, so they've not got a mode of transport. So we've practiced getting the bus with quite a lot of young people to activities as well. So we address any barriers that are in the way and try and help as much as possible to make sure that they're able to get to an activity. And something else as well, that the PFC Trust who employ me, they allocated a pot of funding to be able to access. So if money is a barrier for young people, accessing activity would be able to tap into that funding. So for example, I've got a young person who was not quite ready for a group yet, but she really wanted to do singing. So we've managed to use some of that funding to pay for some one-to-one singing lessons for her. So the confidence has come on so much with these singing lessons. She only liked Adele to start with, but now she likes Billie Eilish. And I just think that's amazing that she's finding out more about what she loves. So that's enabled her to kind of go at her pace. And the hope is that she'll join like a performing arts group at the end of it, so that money's enabled her to access that activity. The same as it could be for bus fares for young people. It's paid for taxi fares for some other young people that the families felt they were too vulnerable to be able to get the bus on their own. Even with offered support, they thought long term a taxi would be good for them, and maybe not in such long term a taxi forever, but I've worked with a young person and they got a taxi because their mum, they were having problems with their eyesight, so they couldn't drive for a while. So this young person was able to get the taxi while the mum was waiting for a ride to get better. So.
Yeah, I think what we found as well is with the social prescribers in Hartlepool, is that there is, I don't know, a lack of skills in working directly with young people. I don't know if that might, but they feel more comfortable maybe in working with the adult people rather than young people. So then there's an automatic referral route into our service to be able to give the young people that support at a time when young people can access it. Like Amelia had mentioned that, you know, young people may be at school or whatever, and it's after 5 o'clock that we then have contact with them, where generally the adult social, we know social prescribing is for everybody. We know it's a cradle to grave, you know, service that is provided, but actually in reality, there is a specific set of skills that you do need to be able, an experience that you do need to be able to work with young people to get them to where they need to be. And that's the differences that we found, certainly.
Do you work with families as a whole unit, or just the child or young adult?
You work like directly with the young person, but sometimes like they might not want to give you the number to be able to text them, so you have to go through the parents to arrange appointments. So you do work with the child, but a lot of the time there isn't like contact with the wider family, whether that's nana, granddad, mum, dad, foster carer.
I assume with the school. Sorry.
I was just going to say we do receive a lot of referrals as well through social care. So there does tend to be, not always, but there does tend to be professional working with that family as a whole.
And I assume that you work with school too, especially with the increase of school refusal.
Yeah, that's certainly been, I would say we've seen waves of referrals since the start of the project. The first one being young older males who've got special educational need. Then we went through a period where we've received bereavement, young people who are experiencing bereavement and needing support around that. And then we're now into a third wave, which is young females who are non-school attenders or school refusers that we are working with experiencing social isolation, experiencing issues within friendship groups. There's a lot going on. Yeah, there's a lot going on at the moment with especially young females that we're seeing. So we do work really closely with schools. Some schools we work with more closely than others, but we've certainly received referrals right across our secondary school to be able to access that support.
Sorry, I was going to say there is My background is a doctor, so is there any link with the children's wards or hospitals? Because there's a lot of, I think we used to see a lot of infections and illnesses, but now a lot of emotional and social problems are on the increase, and they can come quite frequently to the ward. Is there any link and work with the children's ward about reducing such admissions?
We have. So Julian was at a meeting some time ago and met a sister that was part of a children's ward in North Tees. And she has made contact with myself to find out more about the social prescribing project and how they can refer into that. However, her grandmother was seriously ill at one point, so unfortunately we had to cancel that meeting. So we're just waiting for that to be redone.
Thank you very much. Thank you.
Brilliant, thank you. So, and hopefully, Mahfood, you'll see in the chat there, Sarah Penn, who's still with us on the call, is works for Health Partnership as a support officer, but she focuses and knows a lot around social prescribing. So she's put her email in there. So hopefully there's a connection there to North Cumbria. But also, if anybody wants to make a connection with Julian and Sarah and Amelia, with their permission, obviously, I can help you with that. So always come back to us in Boost and we can support you with connecting people together, because that's part of what we like to think we do well. So let's bring this to a close now. I want to say thank you so much, Julian, and to Sarah and Amelia for what sounds like a brilliant piece of work, and we'll stay connected and hopefully we'll continue to share the learning across the North East and North Cumbria patch. So thanks to everybody. Yeah, good few claps and hearts coming out there. Some of you joined a little bit later, so just going to pop back into the chat there a link to our next Lunch and Learn, which is fetal alcohol spectrum disorder, and that's the 21st of February. Tracy, if you wouldn't mind popping the evaluation link back into the chat too. We do really appreciate just a couple of minutes of giving your feedback, because this really helps us to develop this and any subjects that you might want us to cover. So thanks to everybody again, and we'll see you again soon.